Let's talk about shoulder separations. Shoulder separations are injuries of one of the joints in the shoulder and usually caused by a significant direct impact. We should make the distinction between a shoulder separation and a shoulder dislocation. Dislocation occurs with the ball and socket joint. We'll describe that here. And so if that moves out of the joint, that's a dislocation. A separation occurs between the collarbone and the shoulder blade. And we'll draw that joint here, and that's the joint on top of your shoulder. So if that's disrupted, we have an injury there, and there's a few different types of injuries that can occur there. The grade 1, or the most mild, is there's their capsule or ligaments around the joint, and they can be separated or partially disrupted or strained. So that's a grade 1 where there's not significant separation. A grade 2 is when those are partially torn and there's slight elevation of the collarbone with respect to your shoulder blade. You'll see a small bump, there'll be swelling at the area. And then a grade 3 is when there's a complete disruption of not only the capsular structures, but some supporting ligaments. The diagnosis is often made with physical examination, x-rays, sometimes MRI to evaluate the other structures around the shoulder. The treatments for grade 1 injury are a sling, 2 to 4 weeks of rest. Grade 2, usually a sling, and it requires a little bit more, sometimes 4 to 6 weeks of rest. Sometimes there are injections that you can do to treat the pain or possibly to try to heal the tissue with platelet-rich plasma. And a grade 3 usually will require a much longer course of rest and possibly surgery. One of those surgeries is to cut off the end of the collarbone or clavicle and provide for pain relief and a more prompt return to play.